In terms of theory, yeah, it's true, patient needs a doctor, but that's the mindset. When you say that the patient need us, that means we are higher than the patient. You need me, you need to beg for my service.
Yeah. Okay.
But we tell them that no, it's wrong. In Mandaya, it's the hospital who need the patient. We need to make sure that what the patient requires, we can actually fulfill, not just from the clinical point of view. You're talking about also the experience point of view. You're also talking about the emotional, the family point of view, the social point of view, and everything else. And that's patient-centered care. And I think Mandaya will be one of the forefront in terms of providing the best technology to assist our doctors and also to help the patients as well. For our doctors, I think what we always tell them, from the beginning, that we always support their training, their development as well. That we have different programs in Mandaya. For example, we have actually sent some of our clinicians overseas for training.
Yes.
We have sent our cardiologists to China for a year for advanced intervention training. We recently just sent one of our ENT surgeon to Italy as well for minimal invasive ENT procedures. We are going to send one of our hematologists to Singapore for transplant training. So mostly are very advanced training that maybe are not available in Indonesia, or the training is a bit more difficult in Indonesia. We really support them 100%. And not just about this kind of clinical training. We are talking also about research. Some of our doctors want to build their research capabilities. That's why in Mandaya we have our clinical research unit where our doctors can collaborate with our CRU team to create clinical studies together, research together, or even like simple case studies together, providing the best technology for our clinicians. Because when you're talking about clinicians, I think it's sometimes for them it's not just from the financial aspect, but it's about self-actualization. It's about how can we actually support this clinician so that they can actually perform the procedures according to the best guidelines, according to the best way of doing things. And that's what Mandaya always try to do. When we talk to a group of physicians, a group of clinicians or surgeons, that's what we want to provide to them. And by gathering them, by having this vision together with them, collaborating with them to actually create the Center of Excellence that we have. I think, maybe Bu Messi know that we are very strong in oncology. That's one of our Center of Excellence, cardiology, neurology. Now we are moving on to the orthopedic side. We can do robotic knee surgery. We are going to the urology side. And to be honest, we are now preparing ourselves to do transplant, like kidney transplant, liver transplant, very advanced liver procedures, very advanced prostate procedures as well. So we keep pushing ourselves, to the next level and to the next level. And I think going back to the beginning, when I have this, the saying from my parents that to do something, you need to do things not in a normal way, because we want to do things in the extraordinary way. And I think that's what we always try to do.
Hello everyone, I'm Mesiko Sebayang as a commercial business manager in GE Healthcare Indonesia. Today it's a honor for me and us to have the opportunity to gain insight from our inspiring guest, Dr. Ben Widaja, as a President Director Mandaya Hospital Group. Good morning, Dr. Ben.
Hi, good morning, Messi.
It's a pleasure to meet you after we did the signing ceremony between GE Healthcare Indonesia and Mandaya Hospital Antasari. How are you today, Dr. Ben?
I'm good. It's a very awesome day today and very nice to meet you again after the signing of this.
Dr. Ben, before we dive into Mandaya strategy, can you take us back from the beginning? What inspiring you to step into the healthcare world? And did you envision Mandaya one day become a reference point of Center of Excellence that show Indonesia hospital can match or even surpass international standards?
Yeah, I mean, Actually, it started from a long time ago. If I can tell you the story, I rarely tell this story before. Maybe this is like exclusive to GE, right? So, actually, it started when I was only about 15 years old. So when I was 15, I was actually in Singapore. I did my secondary school there, and I've got a phone call from one of my aunt that my dad actually got a heart attack, and practically, I mean, he nearly passed away. Like proper cardiac arrest and everything, CPR, and from there, being a 15-year-old boy, I was thinking like, I might need to actually start thinking about how to help the family, to start thinking about medicine, whether I can actually bring one day my expertise, if I'm a doctor, to help the family. I think that's the start of it. But once I start going much deeper into medicine, I did my medical degree in the UK. I worked there as well, and then when I went back to Indonesia after that, I realized that there are so many gaps, between what the international hospitals are actually providing for the patient and the family, and what the Indonesian hospitals are actually providing at the time.
Okay.
And the vision was actually it's actually quite personal, because if, let's say, me or my family, one day we are unwell and we need some medical care in Indonesia, we want a hospital where we can actually, entrust our health and be really, really confident that we want to have our medical care over there. And I think that's the beginning of the dream. And to be honest, when you ask me about whether we envision that one day we are going to be a benchmark or an excellence, we are very honored about it. I think that's for other people to judge, but what we always want to do from the beginning is, I think, number one is the clinical excellence. It's for us, it's very important. Being a doctor myself, I want to make sure that the hospitals that we are running can actually show the Indonesian market, the patients, that this is the standard that we are going to go after. If you go overseas, international hospital, you're going to get the same standard in Mandaya Hospital, and I think that's number one. But in Mandaya, we are going one step further than that. We are talking about experience. We want to give the best patient and family experience. And I think these two things combined into one will be our strength, to bring the Indonesian healthcare standard to the next level.
Wow. The story is truly inspiring. And then, what personal value of your life experience have shaped your approach to the healthcare leadership?
Yes, when you talk about leadership, I think I need to go back even from the beginning. My parents are actually the first generation, setting up the company. I'm the second generation.
Okay.
And when you look at, I look at my parents myself. My dad and my mom, when they started their first business, basically they are in like a construction company.
Yeah.
And the first job that they took was to repair just about 5 or 6 dining chairs.
Okay.
And we got a small workshop, and my dad was the one who drove the pickup truck himself.
Oh.
And that's the level. It's a crazy, when I think about it, it's crazy. I don't think I can actually go back and start from that level, but from there I can actually, it really shaped me. It gave me like this kind of perception that when you want to do something, if you really put in a lot of effort, you can do it. I think when you ask my parents like 20 years ago, can we actually build our own hospital?
Yep.
But now we are running our own hotels, real estate companies, and now a couple of hospitals that we are building. And what they always tell me is that when you want to do something, as a person, you need to be extraordinary. You can't be a normal person, And the reason why is not because, I want to be great, I want to be arrogant, I want to be, perceived as someone special. No, it's because there's so many other people, so many other companies over there outside who are much more extraordinary than us. If we work so hard, we think that we have been working like crazy hard, but there'll be other people outside who's working double or triple as hard as us. And I think that's the one kind of, the statement that they always teach me personally, that I always try to, to push it down to the next level in the management, from the CEO of the group, and until all the staff. We need to be, as a Mandaya, we need to do things and give the best patient and family experience, for example, because everyone is doing that. And to give the best or the extraordinary experience for our patient and family, we can't do things with the normal way. And I think that's very important, and I think from there, everything just kept clicking together. And, I'm very happy with the team as well, very grateful for all their hard work. And hopefully within the next few years, our team will get bigger and bigger. We need to get a very strong middle management team as well to keep Mandaya growing, and I really appreciate my team.
Okay. You and your parents are so kind-hearted persons, I believe it. Yeah, I almost crying. Okay, you have emphasized that healthcare is not about the equipment, it's about people. Can you share how Mandaya is putting patient at the center? Not only through technology, but also by nurturing a culture of excellence, training, and empathy across all them.
Yeah. There are so many taglines, right? Patient-centered care, placing patient in the middle. Sometimes it's easier said than done, to be honest, right? And it needs to start coming from the top down. Of course, is very important, because that's where the vision come in. Every time we have the town hall meeting for all of our new employees, for example, once every few months, one of the things that we always ask them is that, what do you think is the right statement? Is it patient needing hospital or hospital needing patient? And you'll be very, very, I don't know, very shocking, but for me it's shocking that most of the newcomers, the new staff will say that it's the patient needing doctors. And for maybe, in terms of theory, yeah, it's true, patient needs a doctor, but that's the mindset. When you say that the patient needs us, that means we are higher than the patient. You need me, you need to beg for my service. But we tell them that no, it's wrong. In Mandaya, it's the hospital who need the patient. We need to make sure that what the patient requires, we can actually fulfill, not just from the clinical point of view. We are talking about also the experience point of view. You are also talking about the emotional, the family point of view, the social point of view, and everything else. And that's patient-centered care. And it's not just talking about as if like they are a broken machine that we need to repair. Sometimes as being a doctor, we tend to actually, skew and go to the dark side, start thinking about that. But I think that's something that we always try to do, from the top down, from the vision, from the beginning, that patient experience is very important. We are not selling medical services. We are selling medical experience. And I think that's very important for us. And from there, from the top down, we start building all our middle managers, building the system, building the SOPs, going into detail. For every aspect of patient care, we actually have like a blueprint. From the beginning before they even come to Mandaya, not just when they come into Mandaya, before they come, for example, when they give us a phone call, how can we answer it? How can we give them all the information so that when they come in, they are very confident that we can give them the best care? How we manage them in the hospital, and even after that, the follow-up, asking them, are they feeling better or not? So this whole blueprint, the SOPs, the system, we created. The training is always ongoing, and of course the culture and everything, will be part of the big puzzle as well.
Great. Dr. Ben, the next question: what do you believe are the biggest opportunities and the challenge for Indonesia healthcare system over the next decade?
Yeah, I think there are so many opportunities, so many challenges. I think Indonesia healthcare is growing very rapidly. When you talk about opportunities, you can see that how many trillions of rupiah Indonesian patients are spending overseas is almost like 180 trillion rupiah. That's almost close to 12 billion US dollars actually go to our neighboring countries. Yeah, and the opportunity is huge. Indonesia, we have so many islands from the west side to the east side as well, with a rapidly like increasing in terms of middle and middle up population as well, of course people will start thinking about better healthcare, not just basic healthcare. And I think that's an opportunity for all of us. The challenges, of course, there are many. Some of the notable ones are, for example, the manpower. The hospital can't work without the people.
Yes.
You're talking about the clinical experts, the clinicians. How can we get our clinicians to keep improving themselves?
Yes.
And also get enough clinicians to run the hospital as well. But not just clinicians. Sometimes hospitals or people tend to forget. They are the nursing team. They are the medical physicists, radiographers. The technicians, the lab techs, and everyone. As the hospitals in Indonesia keep growing in terms of volume, of course, the demand for this manpower, for the experts, will be bigger. And I think that's going to be the biggest challenge for all of us. And number two, of course, when you, like for Mandaya, for example, when we want to start bringing in the latest technology, education is very important. Education not just to the patient themselves, so that they can understand what kind of technology are available in Indonesia, that we are not as bad as what other people think. We are actually equally as good, or maybe even better than some hospitals abroad. There's a lot of education that we need to do, but also education to the other stakeholders, the funders, the insurance companies, that certain new technologies actually exist overseas that is not available in Indonesia, that will actually bring a change to the Indonesian healthcare standard. That's the second one that I can think of. But there are so many other challenges, but I think I'm very optimistic about Indonesian healthcare. I think Indonesian healthcare will be, within the next 5 to 10 years, equally as good or even better than all the other companies. I'm very happy that all the other hospitals are also, improving themselves, not just Mandaya. And I hope, within the next few years, our patients can actually have the best perception about Indonesian healthcare and trust us for their health.
Mandaya will be contribute in the healthcare for Indonesia.
Hopefully, yeah.
Indonesia is undergoing major healthcare transformation, especially in technology. Where do you see Mandaya's role in the nation movement? And how does a partnership with GE Healthcare help you into that role?
Yes, I think technology is one thing. When you give a doctor without the right tools, without the best tools, of course, it might be difficult for them to make the best diagnosis and also do the procedures as good as they can do it. And I think Mandaya will be one of the forefront in terms of providing the best technology to assist our doctors and also to help the patients as well. And how to make this technology actually work and suit the Indonesian market. And I think that's very important, because for me, product and market fit is very important. So how to choose the right products, in terms of technologies, and how to actually deliver it, how to educate it to the patients, and how to implement it in the right way. I think hopefully we can actually be the sort of the leading hospitals that can give an examples to the other hospitals and also to the patients that Indonesian hospitals are capable of actually doing, giving the best medical services with this kind of standard. And to be honest, with the collaboration with GE Healthcare, I think that'd be one of the best collaboration. We rarely have such a collaboration that is so deep, that is not just like a technology provider, but for me it's more like a friend, a friend whom I can discuss, I can consult with, when I'm not sure about new technologies, a friend who I can actually discuss, what is the right, the right way to do things, the right investment that can make in the future, not just the GE products, but overall, the medical technology. And I think this collaboration will be so amazing, and it'll be a long-term collaboration, I hope, where we can actually grow together, the Indonesian healthcare standard. And I'm really looking forward to what we can do together next.
With the launch of Mandaya Royal Hospital in Antasari, what strategic purpose does this new facility serve for the group?
I think Mandaya Royal Hospital Antasari will be a very, very important part of our growth. Number one, it is 50% bigger than our flagship hospital actually now, Mandaya Hospital Puri. It will have about 50% more beds as well. In terms of technology, I think Bu Messi know that we have so much more better technology in Mandaya Antasari. There'll be a few equipments where it's still rarely available in Indonesia as well. I'm really looking forward to that. But it's not just about the best technology. We have also gathered top doctors from all over Jakarta, some all over Indonesia as well. We have actually discussed with them how can we actually create a system together, how can we actually create the team who can actually utilize this latest technology, not just per specialty, but it's a multidisciplinary team to do advanced procedures where it's rarely done in Indonesia, or maybe not even done in Indonesia before. And this is made possible, of course, with the technologies that GE and all the other technology partners are actually providing. And hopefully Mandaya Royal Hospital Antasari can actually be the next benchmark. I know Puri is quite a benchmark, people say it, but I think I'm very confident that Antasari is going to be the next benchmark, not just in terms of the best patient and family experience, but this is going to be a very amazing hospital where we can actually provide the best clinical expertise, the best clinical service to our patients and their families as well.
Training and education are so critical in keeping up with healthcare innovation. What is your strategy to support clinician development and capacity building, Dr. Ben?
Yes, I think I totally agree with that statement. Number one, for our doctors, I think what we always tell them, from the beginning, that we always support their training, their development as well. That we have different programs in Mandaya. For example, we have actually sent some of our clinicians overseas for training. We have sent our cardiologists to China for a year for advanced intervention training. We recently just sent one of our ENT surgeon to Italy as well for minimal invasive ENT procedures. We are going to send one of our hematologists to Singapore for transplant training. So mostly are very advanced training that maybe are not available in Indonesia, or the training is a bit more difficult in Indonesia. We really support them 100%. And not just about this kind of clinical training. We are talking also about research. Some of our doctors want to build their research capabilities. That's why in Mandaya we have our clinical research unit where our doctors can collaborate with our CRU team to create clinical studies together, research together, or even like simple case studies together. And I think this is, research and training and education is all in one package, right? And we want to always assist or support our doctors, our clinicians, to help themselves in terms of developing themselves, in terms of research and so on. And other than that, we always have our partners. GE is one of them, to be honest, where we can actually collaborate in terms of training together, because there'll be other GE partners overseas where GE can actually help us to connect, these two institutions together to help us to get to know them, and maybe we can actually send our clinicians or even the non-clinicians, the ancillary medical team, to go to these very prestigious institutions to study over there.
I'm agree also, because GE and Mandaya can create like training for the trainer. So Mandaya also will be immersion site or training site also for the other hospital, not only in Indonesia but also from the other country.
We are very happy to welcome visitors.
Looking ahead, do you envision Mandaya become not just a leading Indonesia hospital, but a benchmark for excellence across Asia and the world? What will it take to get there?
To be honest, we never really think about, are we going to be the leading in the world and so on. We are very honored if people say that, we are there. We are very happy if we can actually be there. But as what I said earlier on as well, what we want to do is just to give the best, international standard medical care to the patient, the advanced medical care in Indonesia for our Indonesian patients. And at the same time giving the best extraordinary patient and family experience. I think these two combination is just our target. And how to get there is very complex, to be honest. I think number one is the vision must be there. The vision about giving the best patient and family experience. I think that's our main, biggest, most important point that we always bring across. And from there, you can actually branch off to the next level. You know, you're talking about how we actually build the very strong management team from the top to the middle managers as well, who can actually bring all of these ideas and implement it to the field, you know, to the people on the ground. And I think that's very important for us. You know, building a very sustainable middle management team is very important to me. And I think the next level is about providing the best technology for our clinicians, because when you're talking about clinicians, I think it's sometimes for them it's not just from the financial aspect, but it's about self-actualization. It's about how can we actually support this clinician so that they can actually perform the procedures according to the best guidelines, according to the best way of doing things. And that's what Mandaya always try to do. You know, when we talk to a group of physicians, a group of clinicians or surgeons, that's what we want to provide to them. And by gathering them, by having this vision together with them, collaborating with them to actually create the Center of Excellence that we have. I think, you know, maybe Bu Messi know that we are very strong in oncology. That's one of our Center of Excellence, cardiology, neurology. Now we are moving on to the orthopedic side. You know, we can do robotic knee surgery. We are going to the urology side. And to be honest, we are now preparing ourselves to do transplant, you know, like kidney transplant, liver transplant, you know, very advanced liver procedures, you know, very advanced prostate procedures as well. So we keep pushing ourselves, you know, to the next level and to the next level. And I think going back to the beginning, when I have this, you know, the saying from my parents that to do something, you need to do things not in a normal way, because we want to do things in the extraordinary way. And I think that's what we always try to do. A lot of people say that, you know, as a hospital, do it step by step, slowly, or it's very difficult and things. But I think, I don't know, people can judge. But I believe that we have proven that we can do it. You know, we have proven ourselves that we can actually go to the next level. We can actually convince the team of clinicians, the management, and even the patients that Mandaya is here to exist and to actually provide the best, you know, international standard medical care to the Indonesian patients.
Dr. Ben, before end our talk show session, do you have any closing statement?
Closing statement, yeah. I think again, I thank you very much for GE Healthcare for being our friend, being our trusted partner in terms of technology. We are very grateful, and we are really looking forward for this new hospital in Antasari, where we can work together, and hopefully for the development of Puri as well, because we are actually developing Puri to the next level as well. But what I want to say is that Indonesian healthcare is improving really rapidly. We are working very hard, not just Mandaya, but all the other hospitals as well. And Mandaya, we want to push ourselves so that we can be a trendsetter, we can be the benchmark of what of how we can actually push the Indonesian medical care standard to the next level. And I hope that by doing this, the Indonesian population, you know, the Indonesian patients can actually trust Indonesian healthcare. You know, we can show them that we can do it ourselves. You know, and we have been doing it really well, to be honest. And please, you know, give us a chance. Please try it out. And I believe that when our patients actually come to Mandaya, experience what we can give to them, you know, our patient and family experience, see our doctors, see how much technology, how much thoughts we have actually put into Mandaya, I hope we can actually change people's mindset of what Indonesian healthcare has actually become.
Yes. And hopefully the patient that already come to the Mandaya come back again to Mandaya, and they can share their experience also.
I hope so, yeah.
Thank you, Dr. Ben, for sharing insightful session with us with GE Healthcare.
Yeah.
And we look forward for another collaboration with GE Healthcare, of course.
Sure.
That's our insightful discussion with Dr. Ben Widaja, CEO and President Director of Mandaya Hospital Group. We hope this conversation has given you fresh insight and inspired you to take meaningful steps toward a better healthcare industry. Until next time, stay well and take care. Bye-bye.